So in your textbook, it's chapter 10, page number 201. Chapter 10, page number 201. Those who have the new edition textbook, you can mention the page number in the chat box of this chapter of electrolytes. (201). Even in the new edition, it's the same page number. So if anyone is joining late, please help them out with the page numbers or topic name, whatever we are discussing at that particular moment. So starting with the chapter, all mineral salts, whose ions dissolve in water, are called electrolytes. Okay, they carry an electric charge. Either it could be positively charged or negatively charged. You can see on the screen with the diagram which is shown. Certain electrolytes, these are able to they dissolve in water. Calcium, potassium, magnesium, sodium. They carry positive charge. Okay, chloride on the other hand, it carries a negative charge. So electrolytes should carry a charge. Okay, they are ions, they carry a charge, only then they can be classified as electrolytes, and they should dissolve in water. Okay? Electrolytes affect your body functions in many ways. Each of the electrolytes which are given in this particular chapter, we'll discuss about three of them: sodium, potassium, and chloride. Okay, so each of them, they have different functions in your in our body. Usually, when it comes to electrolytes like sodium and potassium, okay, they have opposite function. Okay, that's an exchange. Even when it comes to the absorption of sodium and potassium, there's an exchange that is going on. Okay, the body has to give out potassium so that the sodium can be absorbed in. Okay, the major electrolytes are sodium, potassium, and chloride, which we will discuss in detail in this particular chapter. Okay. So milli equivalence, this is the this formula you don't have to mug up. Okay, just understand. I guess from basic chemistries, if anyone remembers, valence, atomic number, molecular weight, milli equivalent, moles. Okay, these kind of molecular formulas, these you must have studied. Okay, in 10th and all, irrespective of whatever branch of studies you have chosen, but majority of the in the high school section you must remember these kind of terminologies. Okay, so the similar formula is given in the textbook as well. So how do we measure electrolytes? Like you must have seen, if you buy a packet of ORS, or you buy glucon D or glucose or any like tank or something like that. Yeah, if you turn the packet, you will read per glass how many electrolytes you are getting. Okay, so these are how do we measure electrolytes? It is in terms of milli equivalents, MEQ. That is how it is represented. Okay, so how do you get milli equivalent? You have to convert the milligrams. Milli equivalent is not microgram. Okay, the grams you are going to take of the electrolyte in grams multiplied by valence. Valence is the, if you remember what is electrons, protons, and neutrons. Do you remember what these terms are? What are electrons? What kind of charge does electrons have? If you remember, anyone. This is basic chemistry. Yeah, electrons are negatively charged. Protons are positively charged. And neutrons are neutral charge. Where do you find the protons? If you remember what is an atom, okay, atomic structure, where do you find the protons? Yeah, it's inside the nucleus. Okay, it has protons and neutrons, both give them the molecular weight. Okay, because of which atom has its mass. Where do you find the electrons? Yeah, there are nucleus in the center, and there is orbits, shells, which surrounds it. Different electrolytes, different atoms. Okay, they have different kind of orbits. Okay, so based on that, you will find the electrons on the outer shell, or not just the shell, all the orbits. Okay, so what is valence? In certain molecules, the outermost shell, how many electrons the outermost shell will have, that is the valence. Okay, what do you mean by valence? Electrons, the number of electrons which is placed on the outermost shell, okay, of the atom, that is the valence, that is the meaning of valence. Okay, then atomic formula, atomic number, or molecular weight. Okay, the total weight of the protons plus the neutrons. Okay, so the information regarding the electrons will be in the numerator, mg, the gram quantity that you take, multiplied by the valence, electrons in the outermost shell, divided by the weight of this molecule, the molecular weight, that is combination of protons plus neutrons. Okay, this is how you calculate the milli equivalent formula. And if you just do the cross multiplication, I guess you all know what is cross multiplication. You can find the milli equivalent formula out of, or you can get back the mg as well out of the milli equivalent formula when you do the cross multiplication. Okay, so is the formula clear, the meaning of this formula from the atomic point of view, from the chemistry point of view? Is it clear? The next major discussion is about this electrolyte sodium. Okay, so sodium is the major regulator of fluid in your body, fluid balance and volume of the fluid. How much water do you have within your body? Okay, these all things are controlled by the presence of sodium as an electrolyte. Okay, it is essential for nerve transmission and muscle function as well, for the health of your nervous system. Adequate sodium will replace your losses in sweat. Okay, when you are physically active, you sweat a lot. If you have adequate amount of sodium while you're drinking any water or any juices, okay, it is always said that when you are doing any physical activity, a pinch of salt has to be added into whatever sports drink or juice, or if it is juice, just add a pinch of salt into that and then have it. Okay, because that adequate amount of sodium will replace whatever you have lost through the electrolytes that you have lost through sweat. Okay, through sweat also you lose a lot of sodium. Okay, it helps you to absorb and retain fluids in your body so that you don't go into a state of dehydration. Sodium helps you to retain fluid in the body, but too much of sodium, what will it cause? Too much of sodium in terms of fluid retention, too much of sodium, what will it lead to? Yes, it will lead to edema or general swelling. Okay, it will lead to swelling of the body or edema, general edema in the body. Okay, so also to distribute the fluid adequately around the body, which drives your hydration. For that also sodium is required. It's not that one part of the body has too much of water retention, the other part does not have. It means that you are lacking sodium. If you have adequate amount of sodium in your diet, in your body, the fluid distribution, the way how fluids are distributed throughout your body is optimal. Okay, so that because every cell requires hydration. Okay, and sodium is positively charged, and it's a positively charged ion. Next, coming to the absorption and excretion of sodium. Every day you require around 3000 to 6000 milligram of sodium on a daily basis through your food, juices, or whatever you take. It's usually through table salt. Even fruits and vegetables naturally contain sodium. Okay, all the fruits and vegetables naturally contain certain quantities of electrolytes. They come from soil. Okay, so but 3000 to 6000 mg of sodium has to be maintained for the optimum health. And the absorption of the sodium takes place in your stomach as well as in your small intestine. And as soon as this sodium is absorbed into the small intestine, it is absorbed in the form of active transmission through diffusion. Okay, because within the intestine, too much of potassium could be there. Potassium is given out, sodium is taken in. Okay, and sometimes directly there are sodium channels in your intestine, small receptors channels in your intestine. Through that channels only sodium can directly get into inside your intestine. Okay, and from the intestine it will be carried by blood, and it will be deposited wherever throughout the body, wherever hydration is required. And excess of sodium, if there is any excess of sodium, it will be filtered out of your body through kidneys and also sweat. When you are losing sodium in sweat, it is not always excess of sodium. You will generally lose sodium in sweat, even if excess sodium is there in your body or not. You will generally lose sodium in sweat. So these two hormones, aldosterone and renin, they are the hormones that control the absorption and excretion of sodium. They monitor the levels of sodium within your body. Okay, aldosterone is secreted by your adrenal glands. Adrenal glands. It's the glands that is on top of your kidneys. Okay, so aldosterone can increase the reabsorption of sodium. For example, uh, excess sodium through the blood that has to be filtered has reached your kidney. Okay, but it got the message that in body sodium levels are falling down, so it has to send a signal to the kidney not to throw away the sodium through urine, reabsorb maximum sodium as much as possible and send it back into the system. For that, aldosterone is used. Aldosterone has that function that increases the reabsorption, reuptake of sodium, okay, from the kidneys. Then we have renin. Renin is a hormone that is secreted by the kidneys, and it converts angiotensinogen into angiotensin 1 to angiotensin 2, okay, and to aldosterone. Angiotensin is all the hormones that are the chemicals that are required to maintain the blood pressure. Okay, angiotensin, it directly affects your blood vessels. The contraction and the dilatation of your blood vessels are controlled by these chemicals. Okay, so that is another hormone, renin, that leads to the secretion of aldosterone. Renin will lead to the secretion of aldosterone. Aldosterone will lead to the reabsorption of sodium. That's how it works. Renin will help out aldosterone to produce more aldosterone. Aldosterone will help in the reabsorption of sodium. Okay, and when there is too much of sodium in your diet or in your body, that excess amount is definitely taken out of your body to maintain that equilibrium through urine as well as your sweat. And some amount of sodium is also removed through your feces as well. Okay, so is it clear, absorption and excretion of sodium? Is the absorption and excretion clear? So next, metabolism. The jejunum and ileum, these are parts of your small intestine as well. Jejunum and ileum. Duodenum, jejunum, and ileum are the parts of your small intestine. Duodenum is the C-shaped area of the gastrointestine. Jejunum and ileum are the coiled part of the small intestine. Okay, jejunum is the firstmost area. Ileum is the area through which the small intestine transitions into the large intestine. Okay. So the jejunal region of the small intestine, by active transport, metabolism, it is absorbed and metabolism takes place. Along with that, sodium is better absorbed in the presence of glucose and vice versa. Glucose is also absorbed better in the presence of sodium. So this is one of the reasons why when you have done any physical activities, any heavy physical activities, you did sweat a lot. Okay, you did sweat a lot. When you take any fruit juices, or you just mix a teaspoon or 2 teaspoons of glucose in water, it is better to add a pinch of salt into that as well. Both of them, sodium and glucose, they enhance each other's absorption. Okay, so in the presence of glucose, sodium absorption is quick. Okay, and why it applies for the same for glucose as well. In the presence of sodium, the glucose absorption is quick. Too much of sodium is definitely a cause of hypertension, because too much of sodium will lead to water retention in your body. Too much of water in your body. So your cardiac output is also increased, because of which hypertension will be there. Blood volume will be increased because the blood volume maximum of it is because of water only, right? So blood volume will also increase. It is not being shed out by the body. So when the blood volume increases, definitely a person will go into a stage of hypertension. Okay. So how do you regulate the sodium intake, sodium uptake or intake? So first is your dietary habits. Too much of sodium, having too much of salty food, packaged food. You take any packaged food, the salt content in it is slightly higher because sodium is also kind of a preservative. It can keep the food from going bad from for a definitely longer time. Okay, so salt is a kind of preservative. Along with that, also it enhances the taste. Okay, salty food is something that people prefer. It is much more palatable. Okay, fried. Is it other participants? Is it audible? Social. Is it fine now? Okay. So the input of sodium is definitely controlled by your dietary habits. What kind of food you're having? Okay, how much salt you're using in your food preparation? And also, do you have too much of packaged food, too much of salty food, too much of pickled items? Okay, these things will affect your dietary habits regarding sodium. And if you are able to achieve control over your intake of sodium, definitely it will have a positive impact on your cardiac health as well as renal health. Okay, if you are able to, there is no other external factors that impacts this. You just have to control your consumption of sodium. It will have a positive impact on your cardiac health as well as renal health. So distribution of sodium in body. Half of the sodium is found in extracellular fluids. Extracellular fluids means the fluid that you find between two cells, few cells. Okay, it is not inside the cells, outside the cells. Okay, most of the sodium is found in extracellular fluid, and just 10% of the sodium what you consume. Okay, if you remember the range, 3,000 to 6,000 milligram of sodium on a daily basis you have to consume. So 10% of that is found in your intracellular fluid. Okay, and the remaining part, very few of it is found in the skeletal system, your teeth, your bones, etc. Okay, not few, it is a much bigger part. Okay, and also the sodium that you find in your skeletal system, they act as a reservoir. Whenever your body goes into any dire circumstances in which it is deprived of sodium intake, it will go to the skeletal system and collect back the deposited sodium. Okay. Yeah, in metabolism, directly because of active transport, diffusion and active transport in the jejunum and ileum part of your small intestine, sodium is directly absorbed into the small intestine. And from there, it will go into the blood circulation. And also the presence of glucose. Okay, presence of glucose along with certain proteins. Okay, they can enhance the absorption of sodium. High sodium, more than it affecting bones, it will first affect your circulatory system. It will first affect your circulatory system and your renal system. Okay, because the impact of taking away the excess sodium and dumping it into the urine, that task lies on the renal system. Okay, and if it is still high, only then excess of salt may be taken up into the skeletal system for deposition. Okay, but that is secondary and tertiary situation, but the first organ systems that are affected by high sodium content is your circulatory system, that is your cardiac system, and your renal system. Okay. Hyponatremia. So hyponatremia means very low amount of sodium found in your blood circulation. Okay, it's not just low sodium content, it is the low sodium content in your blood circulation, hyponatremia. This is the medical terminology. Okay, so it causes certain signs and symptoms like confusion, short temper, fatigue, convulsions, seizures, feeling weak in general, loss of your consciousness in severe cases. Okay, you are hyponatremic since few days, only then you go into a state of coma, loss of consciousness, low blood pressure. Low blood pressure, extremely low blood pressure is also lethal. Okay, it can be fatal. And then feeling nauseous or vomiting. Okay, so these are the signs and symptoms of it. It is very common signs and symptoms, but see, these kind of signs and symptoms, you cannot just look at these signs and symptoms and say the person is facing from hyponatremia. Okay, you have to do the blood analysis. Blood analysis has to be done to confirm it. Okay, because the general symptoms which we have stated here is also found in various other disease conditions as well. Okay. Low blood pressure patient will also have to focus on um, the same content of 3000 to 6000 milligram per on a daily basis. But if you are a low BP patient who are admitted in hospital, through the IV fluids, normal saline will be put inside your, it will be given so that your fluid balance comes back into normal. Okay. In hospital, if you're getting admitted because of hyponatremia, the first thing they will do is to put you on IV fluids. Okay. So sources of sodium, table salt, that is the best source. All salty food, animal foods also have sodium because the flesh has sodium in it. Milk, baking soda, eggs, cereals, carrot, tomato, legumes, all fruits and vegetables do have sodium in it because soil has sodium. Okay, so that will be transferred to the growth of fruits and vegetables as well. Then RDA 1 to 5 gram is required on a daily basis, which means if you convert it into milligram, it is almost the same range which they have given in the textbook as well. Okay, 1 gram of sodium per day for people who have an history of hypertension. But this is again a very general statement. 1 gram of common table salt on a daily basis for BP patients. It's a general statement because it completely depends on their blood pressure, their history of blood pressure, since how long they are suffering from blood pressure or any other cardiac disorder, and accordingly, how much amount of salt is considerable for them or taken by them is given by the cardiologist and the dietitian from the hospital. Effects of excess sodium, too much of sodium. Okay, hyponatremia, definitely high blood pressure, heart failure, left ventricular hypertrophy, that is your heart is divided into 4 chambers. Okay, left ventricles, right ventricles, left atrium, right atrium. So the left ventricle, which is the bottommost part of the heart, that will go, it will expand because of the heart is pumping a lot. Heart has a lot of cardiac output. Cardiac output of heart has increased. So because of these reasons, the left ventricles undergo hypertrophy. Hypertrophy means they increase in their size. Okay, heart size will increase in general. Stroke in some severe situation, gastric cancer, edema, kidney problems and kidney stones can also take place. Okay, so these are the effects of excess sodium. So till here, is it clear to all? About sodium, is it clear to all? Next is potassium. So potassium, again, it's a positively charged ion represented by K and a plus. It means potassium ion. And sodium and potassium are known as alkali forming ion. They make your body not acidic but alkaline. Okay. And the total potassium in the body is around 250 gram. Total potassium in your body is around 250 gram. So these are the functions of potassium. Page number of potassium is 205. Please check with your new edition textbook as well. Is it the same? It's the same chapter. It's not a different chapter. It's the same chapter. So potassium again will help your body to uptake nutrients and water. It helps your muscles to contract. Okay, to help your muscles to contract. It helps your nervous system to carry messages between the brain and the body, similar to sodium as well. Sodium also has a similar function. So potassium also helps in the health of your nervous system. It balances your body fluid and it regulates the blood pressure as well, because they work hand in hand in cardiac emergencies, myocardial infarction or any cardiac emergencies. Uh, Potassium chloride, okay, is considered as an emergency drug, okay, emergency medication. And it's a high alert medication. Any electrolytes in hospital, when you use any electrolytes in hospital, electrolyte injections in hospital, is a high alert medication. And also potassium helps your bodies to digest food easier. Okay, this is the general it's the general functions of potassium. And some other information is given in the textbook as well regarding the potassium, where extracellular fluid, how much potassium you will have, it's around 80 millimole is the amount of potassium which is present in the extracellular fluid in your body. Okay. Whereas in the tissue around it is around 3,500 millimole. These are just facts. Okay. You can just underline these facts for later discussion, etc. 80% of the potassium is again found in your skeletal muscles. Okay, just 20% is found in your body tissues, other body tissues in the fluid part of your body, intracellular, extracellular. But majority of the potassium is deposited in your skeletal muscles. Okay. Absorption and excretion of potassium. It is readily absorbed by passive diffusion from the gastrointestinal tract. Directly, it will just directly get inside the intestine. Okay, that is what you mean by passive diffusion. The amount of potassium in the body depends on the balance between potassium intake and output, very similar to sodium. The amount of sodium-rich food you have, definitely your body will have high sodium content. If you have too much of potassium-rich food, your body will have too much potassium content. Okay, so that is the balance between the potassium and sodium in your body is completely based on how much you are having on a daily basis, what kind of diet you are practicing. So potassium output occurs through three primary routes. How does the body get rid of excess potassium? It's through your GI tract, that is your feces, skin, through your sweat, and then urine. Okay. So natural diets, whatever food sources they come in natural form, like fruits and vegetables, 50 to 550 millimoles of potassium definitely comes from your natural food. Like that is like fruits are rich in potassium, vegetables are rich in potassium as electrolytes. Okay. And potassium deficiency and all, it is very rare because majority of whatever you eat has potassium in it. Even it applies the same for sodium as well. Nobody actually goes into a state of deficiency of potassium or sodium until and unless the person is malnourished. Okay. Coconut water as well, not just potassium, but it is rich in other electrolytes as well. Okay. And also people who frequently consume a lot of diuretics. Can you give any example in which diuretics are consumed frequently? Yeah, Lasix is a diuretic, but when you are treating certain cardiac disorders, okay, when you're treating hypertensive patients, diuretics are prescribed. Okay. So frequency of diuretic or overconsumption of diuretic, okay, without physicians guidance, because some, if you are aware of it, some supermodels and some celebrities, they also use potassium based diuretics, or not potassium based diuretics, general diuretics. Could you know the reason why? Why people may abuse diuretics? To lose water weight. Potassium, diuretic won't make you thin, or it will not help in weight loss. It helps in the loss of water weight. Okay, so water, even if you, certain days if you wake up puffy faced, okay, you didn't have a good night's sleep, you wake up puffy faced, and you have a photo shoot or something like that, you may perform some diuretic or something, just so that you can get rid of that excess water from your body. You can look bit more chiseled, bit more skinnier. Okay, it will not lose you, it has no effect. Diuretics have no effect on the fat content of the body. It will just take out the excess water weight from the body. Okay, so yeah, misuse of diuretics could lead to excessive loss of potassium from the body as well. Okay. And even in diarrhea, if diarrhea, continuous vomiting in pregnancy and all, morning sickness, continuous vomiting could lead to reduced potassium concentration in the body. And diarrhea, continuous diarrhea, infective diarrhea, that could also lead to potassium loss. Bananas, it's you cannot eat banana just for the sake of losing water weight. That's not how it functions. Okay, banana is high in fructose as well. Okay, banana is definitely a good source of potassium, but it is not the only source that you get from banana. The only nutrient you get from banana. Banana is a good source of fiber as well. It is high in fructose as well. Okay. So potassium deficiency, very rare. It's not common. It's very rare. But these are the common things that you can find in a potassium deficiency: low blood pressure, weakness, fatigue, and hearing, speaking difficulties, heart palpitations, tingling, and numbness sensation, which starts in the tip of your fingertips or toe tips, muscle cramps, mood swings, digestive problems. Okay, again, all these signs and symptoms which we are seeing here, it's not just potassium deficiency, but other disorders can also showcase these specific signs and symptoms. Okay, so again, blood analysis is required, blood report is required to conclude that the person is going through potassium deficiency. So RDA is on table 10.2, page number 207. Those who have the new edition textbook, you can mention the new page numbers as well. Is it the same? Same page number. Okay. So again, RDA any RD related questions come about, it would be very rare, but if at all any RD related questions of potassium they come, you can directly go to this page number and see the correct answer, and you can give the you can choose the correct options. Okay, you can here you have to see the ratio in which they have given sodium and potassium, the ratio how it has to be taken. The molar ratio is also given. Man, woman, infants, children, pregnant women and lactating women, it will be very similar to a adult woman. That's why they have not mentioned it as a specific category. So RDA, just go through it. No, don't mug up any RDA table or any don't mug up any tables. Just understand in which chapter you will find information from this particular table. Okay. So toxicity of potassium could lead to cardiac arrest, renal failure. Too much of potassium could lead to cardiac arrest and renal failure. Sources of potassium. Which is the best source of potassium from the table 10.3? You can mention in the chat box. Name the 3 best sources of potassium. Those who have not received the textbook yet, it would be a knowledge for them as well. 3 best sources of potassium from the table. Table 10.3, few food products they have written, food items they have written. And every 100 gram of this particular food, how much sodium, how much potassium will you receive is also mentioned. Yes, black gram, green gram, and soya bean. It's above, and also black raisins. 100 gram of black raisins, black dry raisins. What is the potassium per 100 gram of potassium found in banana? It is given in the textbook. It's just 300, almost 300 gram. Okay, so banana is a good source of potassium. It's not the best source of potassium. Okay, you can't just have banana just for the sake of losing water weight, because see, 100 gram of banana, it can only give you 306 milligram of potassium. Okay. Next is chloride or chlorine. So it is present as chloride ion, Cl, and minus is what you use to represent chlorine. It is a major anion in the extracellular fluid. The major functions of chloride, it is to regulate the water balance, osmotic pressure, and it is a part of the NaCl, that is your table salt, and it also maintains the acid-base balance within your extracellular fluids and intracellular fluids as well. Not making it too acidic, not making anything too basic, because as we know, sodium is what does sodium convert your extracellular fluids into? Is it acidic or basic or alkaline? What would sodium convert your body fluids into? Acidic or alkaline? It will convert your body's fluids into alkaline in nature. Also potassium. Okay, so too much alkaline nature is also not required. You have to create that acid-base balance in your body. For that, sodium comes into the play. Okay, it also helps in nerve impulse conduction. Same, sodium, potassium, and even now chloride, it has the same function when it comes to your nervous system, health of your nervous system. And hydrochloric acid formation in the stomach, chlorine is required. HCl acid found in your stomach for digestion and breakdown of food. To make that hydrochloric acid in your body, chloride is required, chlorine is required. So these are the major functions of chlorine. In detail, they have just mentioned in the textbook. Okay, it's the same thing. And also about red blood cells, the function of chloride ions in helping the red blood cells in transporting the oxygen in and out of the red blood cells is also also a major function. So they, because of the presence of chlorine, the in the extracellular fluid, they are able to readily move in and out of the red blood cells. So in that way, they are able to transport because of this particular function, the red blood cells are able to transport or deposit the oxygen into the extracellular fluids, which are coming in and out of the red blood cells. Okay, it is because of the presence of chlorine. Absorption and excretion of chlorine rapidly and almost totally it is absorbed in the gastrointestinal tract, and under normal conditions chloride excretion occurs in three ways, again through your feces, your skin, through sweat, and through urine. Okay, in these three methods chlorine can exit, excess of chlorine can exit your body. Okay, and the chlorine that is excreted in the from your body is mostly in the form of sodium chloride. Along with the sodium, chlorine will be exiting. So it usually is in the form of sodium chloride that it leaves the body. And also when it enters the body, it's also the same way in the form of, say, table salt, sodium chloride. It enters the body and leaves the body also in the same combination. Chiefly it will be expelled out of your body through urine, kidneys. About 2%, only 2% of chlorine is considered to be eliminated through your feces. And plasma chlorine level, the normal plasma chlorine level should be around 95 to 105 milliequivalent per liter of your blood. So the chlorine deficiency, it is very rare under normal circumstances. Nobody can have chlorine deficiency. It does not occur under normal circumstances until and unless you are malnourished. Okay, only then these kind of micro deficiencies can be seen in the patient. The sources, the best source of chlorine, again, it's your table salt, common salt, which you use in cooking. That is the best source of chlorine. Deficiency, again, it is rare. Sources, it's your table salt.